Sitting with us right now, it is a pleasure to welcome Dr. Byron Schlomach, Goldwater Institute Healthcare. Doctor, welcome to the show. We appreciate having you on.
Thank you. It's good to be here.
Why is healthcare more expensive in Arizona than it is in other states? California, to be specific.
It is surprising, isn't it, that California would be less expensive, one of the lesser expensive states with healthcare, health insurance costs. But you have to remember, of course, they have a large pool of people to pick from.
So more money is going into the pool, so therefore we can sell it at a lower rate.
Well, just having a larger pool of people represents less risk for an insurance company.
Okay.
And so they can afford to offer lower insurance rates. But another issue is that different states mandate different types of coverage. Now, as it turns out, it's probably the pool, the size of the pool, that makes Arizona relatively more expensive, about $500 a year. But because Arizona doesn't have the mandates that California does. But what we're recommending is that the states sort of take the bull by the horns. We're all waiting for the federal government to do something about health insurance costs. And, of course, we have another presidential election to go through and wait for. And but the states can take action now. People are not allowed to buy insurance from California. If you live in Arizona, you buy an Arizona
So you can't
policy.
you can't shop around. And
Right.
Brian, when you say mandates, are these state-regulated mandates? Is what we're talking about?
Right. For example, most states require that alcoholism treatments be covered in their health insurance plans. A number of states require that chiropractic care be covered in a
So it
health insurance
varies
plan.
from state to
State to state.
That's right. And of course, individuals individually benefit from these mandates differently. For example, a teetotaler might prefer to have an Arizona policy where that's not mandated.
Right, so therefore his premiums will be.
They'll be higher in another state because he's having to help pay for the alcoholism treatments of other people.
You're looking to change this. You're looking to allow Arizonans to buy insurance from other states.
Anywhere at all. And now, of course, if you buy a policy that's written in California, what you're doing is you're buying into a larger population pool. If all the states did this, one of the benefits would be that you'd be able to take your insurance across state lines. You wouldn't have to worry if you changed jobs and moved from another state.
So essentially, you want deregulation.
That's right. It is. It's a type of deregulation.
Just like with what happened with the communications industries.
Exactly.
And certainly the consumer in the long run certainly saves a lot of money that way.
Absolutely. Deregulation in every industry where it's been tried, it's worked well for the consumer. Some of the companies in the industries might not have been particularly happy about it, but the consumer has always benefited.
Now, what's the process to go through to allow this to happen?
Well, the Arizona state legislature can simply open up the insurance market to competition anytime it wants to, and that's what we're recommending, that states go ahead and move. Now, Congressman John Shadegg from Arizona has proposed a federal law to basically require the states to open up their insurance markets.
So basically, Brian, this would be a lot more competitive, is what you're saying. And
exactly.
Competition does breed lower prices in many cases, and certainly bodes well for the consumer.
Right, and we would all benefit from being able to carry our insurance policies with us from state to state. We would benefit from being able to buy into larger pools. We would benefit from being able to buy insurance policies that are suited to our particular needs. Again, you come back to chiropractic services. Some people enjoy a lot of benefit from that, others don't. Some people believe it works, others don't.
So we could build our own individual policy.
That's exactly right.
It makes so much sense. I'm so afraid that it may not happen.
She makes good sense, doesn't she? What's the opposition saying to this? Why wouldn't it work?
Well, one of the things that might be raised as an objection is, well, if you're buying a California policy, how in the world do you force companies to live up to their obligations if you're living in Arizona? Well, the fact is, if a company doesn't have to sell its policy in Arizona if it doesn't want to, but if it does, at that point it is subject to the Arizona court system. The contract at that point is enforceable in Arizona, and so it would be enforced through Arizona courts just like any other type of contract.
That makes sense.
So, frankly, the only other kind of opposition that you would tend to see is people who like the current mandates. If you're living in another, clearly, someone has gone to various state legislatures and demanded that certain things be covered. Sometimes it's another legislator. You can probably tell I have a little bit of a drawl. I recently came from Texas.
Yes.
And you catch that one quicker than any dialect out there.
Right. Well, there was a legislator there, I remember, while I was working around the Texas Capitol, whose wife got some benefit from a massage therapist. It wasn't covered under the state insurance, and so he simply passed a bill to get it covered under
Well,
the
you know,
state.
and bringing that to the forefront of our thinking, the Geico commercial, I don't know if it's Geico, one of them out there, the tree falls on the car in the commercial, and it's not a ficus, so it's not covered.
Right.
The name scratched on the car, and they only cover Kevin, they don't cover John. And so that brings to our consciousness how so very ridiculous insurance coverage can be.
And it can be, but of course one of the wonderful things about a nationwide type of market system like we have in cars, for example, is that you can buy a magazine that tells you all about the cars that are available all over the country. Right now, if you wanted to buy a magazine or an informational bulletin or something like that to find out about insurance, it has to be customized to each state, and that's just not as economically
And isn't that
viable.
where we live? Don't we live in a capitalist country where free enterprise run, and don't we want the private sector to run this and really not get Big Brother involved in this? I mean, I don't need more Big Brother in my life, quite frankly.
But aren't they afraid, though, on the other side of that coin, aren't they afraid that this will take it out of the state's control and give it a nationwide control and therefore have umbrella?
Well, what it's doing is it's taking it out of state government control and putting it into market control. And yes, it would be a nationwide market, but that benefits us all.
And again, it's supply and demand. It's basic economics is what we're talking about here.
Exactly, exactly. And so we can come out much better off as consumers. We can get a better product at a cheaper price.
And don't we need that in the healthcare?
Badly. That's one of the biggest worries is how fast healthcare costs have been going up.
Very desperately. Something has to be done.
It's due to a lack of market.
To me, it makes everybody work harder to give us higher quality healthcare at a less price. I'm for it.
Definitely. You've got my vote.
Thank you.
Brian, thank you so very much.
Thank you.
Appreciate it very much. Thank you for being on the show.